Good evening, everyone, and thank you for joining us. Very warm welcome to you this evening as we have another Wiltshire Council COVID-19 public update. I'm Kerry Tocock, the Head of Communications, Marketing and Events at Wiltshire Council. So just to let you know, if you wish to see the closed captions of the speaker's words this evening, please click on the CC button on the right of the screen. They should appear after about 30 seconds or so, sometimes a little longer. If you have any technical issues this evening, they're usually solved by closing down the meeting link and then rejoining. You're welcome to submit a question to be answered using the chat function. We will try to provide written replies in the chat, and our presenters will also verbally answer as many questions as they're able to this evening. So I'll hand you over to Councillor Philip Whitehead, Leader of the Council, to get us started.
Good evening, everyone. I'm Philip Whitehead, Leader of Wiltshire Council. Welcome back. This time I managed to unmute myself before I started talking rather than afterwards. I hope you're all doing okay and managing well through lockdown. I'll keep this introduction brief as there's a lot to get through tonight and we've got more speakers than we normally have. As always, I wanted to start off by thanking you for all your ongoing support through this situation. We are very aware that so much is asked of you. Lots of messages about guidance and restrictions and changes are thrown at you from all angles. We'll do our best tonight to keep things straightforward and accessible. And as always, our ultimate aim is that you leave this meeting better informed at the end than you were at the start. Tonight, you'll hear from Andy Brown, our Corporate Director of Resources, who will briefly talk about the 2021-22 budget proposals, how COVID-19 has impacted those, and what we're planning to do to help you and the county recover. Terence Herbert, the Council's Chief Executive, will update you on the various elections taking place this year and the extra planning involved due to COVID. He'll also speak how we're making the best use of our staff to support the ongoing recovery work. Our Director of Public Health, Kate Blackburn, will provide you with the latest local COVID statistics, the all-important context behind them, and an update on community testing. And last, but very much not least, I'm delighted that we are joined by Jill May from the Bath and North East Somerset, Wiltshire and Swindon Clinical Commissioning Group. Jill is the Director of Nursing and Quality, and she's on hand tonight to provide an update on the local COVID-19 vaccination programme. And I know many of you will be interested in that because we've already had lots of questions on it. We'll answer as many of your questions as we can. Some have been sent in already, as I just mentioned, and thanks to those of you who have done that, but we'll also respond to others that are asked tonight. Right, let's get on with it. First of all, here's Andy.
Thanks, Philip. Good evening, everyone. So just going to run through some of the budget updates this evening. Just like all local authorities, Wiltshire's finances have been hit hard by the pandemic, but our commitment and focus is to ensure our residents, businesses and communities get all the support they need to help them recover from the damage caused by the pandemic. There are challenges ahead, but we will be investing in vital services and programmes to not only help our communities recover, but to enable them to thrive. We've always been diligent with our finances, and that's ensured we have a strong foundation in place to deal with the unexpected, although no one could have predicted the profound impact that COVID-19 has had, rather. The Council's budget, just going to get a bit technical here, the Council's budget is split into two elements. So revenue, which is our day-to-day operations and effectively funded by council tax, business rates and government grant. And then secondly, as well, capital investment, which is on longer term infrastructure and funded by debt and government grant. So just going to talk about each of those aspects. So we could go to the next slide, please. So in terms of the revenue proposals, the proposed revenue budget gives paramount importance to protecting frontline service delivery during the pandemic and as we move into recovery. A significant level of investment is going into adult social care, and as you can see, over 8.6 million is planned, together with a 6.6 million allocation for investment into children's social care. On top of that, there's a further 1.5 million that's going to be invested to respond to rising demand for special educational needs service. A planned saving of £1 million in public health and changes to library provision have been reversed in next year. We're also allocating a £4 million fund over the next 4 years to support the recovery of Wiltshire's market towns that have been hit hard during the pandemic. During 21-22, the council will also insource the remaining leisure sites so that all leisure services will be operated by the council by the end of the year. So to fund that, there is a proposal of a 1.99% increase in basic council tax. In addition, there's a 3% levy specifically for adult social care to address the 8.6 million growth due to the increasing age demographic and needs of the residents of Wiltshire. We're also proposing a six-fold increase in our discretionary hardship fund to £300,000. This will be held to assist those families and residents that, after undertaking all avenues of support to reduce their council tax bill, still need further support and help from the council. Go to the next slide, please. So just going to focus a little bit on our planned capital investment. So over £200 million will be invested through the council's capital programme in 2021-22. We're planning investment of over £50 million in housing for Wiltshire, and that will deliver around 1,000 new council houses provided over the next 10 years. We're also investing over £22 million in maintaining Wiltshire's road network, over £23 million in our schools, and that's including the replacement of the lower block at Amesbury Stonehenge School. Continued investment of over £20 million in the council's health and wellbeing centre sites. That also includes the significant investment in the Melksham Community Campus. Continued investment into carbon reduction initiatives with £3 million for the final transition to the LED streetlights, more than £4 million for energy efficiency projects for the council's own buildings and estates. The draft budget proposal is currently going through a scrutiny process, and they'll be put forward for discussion at a meeting of full council on the 23rd of February. Thanks for listening, and I'll hand over to Terence.
Thank you, Andy, and good evening, everyone. It's nice to speak to you all again. So aside from our ongoing response to COVID-19, the biggest priority as a council for us is to hold safe and democratic elections this year. So you probably know there's been some national discussion and debate about whether the scheduled elections should take place. But as we talk tonight, we haven't been told they're going to be postponed. So as you would expect, we're planning on the assumption that they're going to go ahead on the 6th of May. In Wiltshire, the elections include the Police and Crime Commissioner election, for which we're the local lead authority. We've got the Wiltshire Council Unitary election, of which there are 98 divisions, and there are 307 town and parish elections and around 10 to 15 neighbourhood planning referendums. So that's quite a sizable number of elections. We're expecting around 2,500 nominations in total. So it really is going to be quite a few busy months ahead. Now, we had a very successful general election in December 2019. So we're used to challenges. That was at short notice, but we managed to arrange it. Now, obviously, the main challenge for us this year is rather different, and it's the unpredictability of the pandemic and the ever-changing national picture. Our priority, as you would expect, is that everybody involved, including staff, candidates and voters, are safe. And that means that we have to ensure that any venues that we use are COVID secure. Now, obviously, we hope that by spring, the situation will have improved. But regardless, there are likely to be people who would much rather vote by post. And I'd encourage you all to register to do that sooner rather than later. You can do that by visiting our webpage, which is wiltshire.gov.uk/elections. Now, to keep our electoral records up to date, we sent out our household notification letters this week, and they went to every household in Wiltshire. So please keep an eye out for them. If anybody eligible to vote isn't listed on that form, then that person needs to register on the Register to Vote website, or they can phone us on 0300 456 0112. We'll put all this information in the chat, you can see it. If anybody needs to be removed for any particular reason, they've left a household, for example, there are clear instructions on the letter on how to do this. You'll also find details on how to register to vote by post if you haven't already done so. So I'm pushing this voting by post. It really is going to make things much easier the more people choose to vote by post. Now, the running of elections is always greatly aided by residents offering us their assistance. And understandably, there's probably going to be a bit of reluctance from some to get involved this time. So in terms of planning, we've had to bear that in mind as well. However, I want to reassure you that anybody who does put themselves forward to support us, that their safety is my priority. Now, if you think that you might be in a position to help, or someone you know might be in a position to help with the election, then do please make contact with us via elections@wiltshire.gov.uk. To ease the pressure and to take into account the situation, we are looking to spread the verification and the count over 4 days instead of the usual 1 day and night that we're used to. It just wouldn't be possible to do all of those elections within that time frame. I do want to emphasise, though, that we want as many people as possible to have their say in these elections, and we'll be working hard so that people can do that as safely and easily as possible. It's very important that we live in a democratic county, and we're going to do our utmost to ensure that the pandemic doesn't get away with that. So once again, if you can vote by post, please vote by post. Now, finally from me, I wanted to update you on one of the key elements of our response to the ongoing pandemic. I'm really proud to lead an organisation that's got a highly skilled and agile workforce, people who are willing to step outside of their comfort zones and normal roles and do something different. Now, with that in mind, we're in the process of redeploying staff to help in some of our really key priority areas, such as supporting our business grants teams, preparing for the elections, helping with our local test and trace service, and staffing our wellbeing hub. And that's only a few of the things that we're doing. Now, as well as our own services, we're also supporting our partners by redeploying staff to work with them on projects, such as running the mass vaccination centre in Salisbury. And we're also supporting our partners NHS by redeploying staff to assist with increased pressures at some of the hospitals in Bath, Swindon and the Wiltshire area. Now, that's an approach which we at the Council have been exemplar among local authority peers, and we're at the forefront of the national response effort. It's really important that these key services in the NHS have the right people in place to help us, us as residents and our businesses to get the support they need as quickly as possible. So I was really pleased that we were able to offer that support, and that Philip agreed that that's what we should be doing. I'm not really one for patting ourselves on the back too much. We are public servants. We are just doing our jobs, but I thought it was important for me in a public setting to thank our staff for stepping up to the plate recently. They have done a fantastic job, and that's particularly as local authorities outside the NHS are probably the biggest responders to this pandemic. It has been a really busy, fast-paced and high-pressure time, and our staff have really stepped up. So that's it from me, and I'd like to hand you over to Kate.
Thank you, Terence. Hello, everybody. It's lovely to speak to you again. So when we last spoke 3 weeks ago, we were in the midst of a really difficult situation. Latest COVID-19 case numbers at that time had tripled in a period of just 3 weeks, and Wiltshire was very much heading in the same trajectory as we were seeing nationally. Now, since then, it's encouraging to see case numbers coming through on a daily basis have started to decrease and slow down. Our data shows that in terms of positive COVID cases, we hit a peak exactly 2 weeks after Christmas Day, which is unsurprising, really, given that households were mixing more on that day. However, our rates are still very high, so it's not something we can be complacent about, and we all still need to be extremely vigilant about how we act and behave to keep on minimising that risk of transmission down and protect ourselves, our loved ones and our communities. So let me take you through the latest figures. Now, again, just a reminder, these figures are for the Wiltshire Council local authority area. They do not include Swindon numbers. So if we can pop on to the next slide, please. So data published from yesterday evening shows that we've had a total of 13,630 confirmed cases of COVID-19 since the pandemic began, with 1,270 cases in the last 7 days of reported data. So that gives our current 7-day rate of infection per 100,000 population as 254. And as you can see from the slide, this has reduced from a rate of 355.8 from the previous 7 days. Can we just pop on to the next slide, please? Now, whilst this reduction is good, you can see that our cases in this graph, much like the national picture, are not decreasing as quickly as they increased during December and January. And I also really wanted to highlight here, if we think back to the autumn, if a local authority's case rate went above 20 per 100,000 population, this was considered a very high rate and immediate action was required. So we must remember that the rate now is still extremely high, and we can all take steps to minimise the risk to ourselves and our loved ones. Now, in our county, we've seen cases fairly evenly spread geographically. We haven't seen hotspots, particularly in any areas. And what we have seen is the highest rates of infection have occurred in our 20 to 24-year age group. Now, we know that this is primarily driven by the type of employment that these young people are in, and being unable to work from home to minimise their risk to the level that some of the other age groups are able to. But again, at the moment, the rate in this group is also decreasing. So we thank everyone for all of your efforts to achieve this. Now, as Philip said, a lot is being asked of you, and our population in the main are doing so well at following the guidance, and that's contributing to the case numbers gradually falling. So again, thank you. We know that this isn't easy in any way at all. Now, it's never our intention to scare anyone in terms of sharing these figures with you or highlighting just how high the case rate still is, but it's so important that we're honest and you understand the full picture so that you can make those informed choices. The new variant of COVID-19 continues to be extremely transmissible, so every contact we have with people, whether that be in the street, on our doorsteps or in the supermarket, means there's a risk that the virus could spread. So every time you choose to leave your house, that decision could have a negative impact down the line. So please only do so if it's necessary. And also remember to keep washing hands, 20 seconds with soap and hot water. Keep at least 2 meters apart from people not in your household, and make sure you're doing this outside as well as inside. It's so very important. And wearing face coverings where required. Those simple pieces of advice are still the most pertinent for us all. 1 in 3 people that have COVID-19 don't display any symptoms of the virus. So acting like you have the virus and doing everything you can to stop it spreading will help. Our health and care services are stretched, and your sensible and cautious approach can really help to support them. We're in the planning stages of introducing community testing for asymptomatic people, and I'm really keen to target those areas of the community that are not included in the national testing programmes run by central government departments. So this would include smaller businesses where their staff can't work from home, frontline staff working with vulnerable individuals, and emergency services where disruption to essential service is a real risk. I'm treating rapid testing very cautiously, but if it's used alongside all of our other infection prevention and control methods, it can be a really useful tool. However, a negative test is not a passport to freedom, and people still need to take all other measures and precautions extremely seriously. As I said, we're in the middle of planning the introduction of this targeted community testing, and we'll have more details on this very soon. I do just also want to acknowledge that many sectors are feeling anxious about community testing and the ability to access this, and so we are doing all we can locally to make sure that priority groups are being highlighted to the national teams. The Department for Education and Skills has worked with secondary schools to support them to carry out tests with staff and those pupils who are attending school currently. And these are the children of critical workers or vulnerable pupils. Primary schools are also now testing their staff. And you may have heard, but earlier today the Prime Minister confirmed that schools will not be fully reopening until March the 8th at the earliest. Now this continues to be a challenging time for them, and we will continue to regularly offer advice and support to all of our schools. One of the other tools at our disposal locally is Test and Trace. I'm pleased to say that across Wiltshire, 97% of our cases of COVID are being successfully contact traced by either NHS Test and Trace nationally or our local tracing partnership. For our local service, our team have been reaching around half of the cases we try to follow up, and that may sound like a low percentage, but these are cases where often the contact details are incorrect and the national team have been unable to contact them. So we're putting all our local knowledge at the fore to make sure we're reaching people who need our help. Feedback on this continues to be positive, and our call handlers are able to signpost individuals to sources of support to enable them to self-isolate and hence reduce that risk of transmission of the virus. So please save 0300 456 0100 into your phone so that if you do need to be contacted by a friendly team for any reason, you know who it is that's trying to reach you, and we can make that number available in the chat as well. Now, some of you may have seen, we recently launched our Jog On campaign. We had seen recent reports of places like Laycock being particularly busy with people going there to get their exercise. So we're just reiterating our key messages that you should be staying local when doing your daily exercise. Look out for some social media posts, and we'll be putting posters up at some of our beauty spots with some of those messages. And you can also print a poster off of your own for the COVID-19 page on our website. Now, we of course don't begrudge anyone getting fresh air and being active. We know how good that can be for everybody, but we do just need people to think sensibly and do it from their front door wherever possible, rather than travelling out of your local area. Our beauty spots won't be going anywhere, so hopefully later this year we can all enjoy them once again. So thanks again for all your support, as we know this really is not an easy time. And as you'll hear in a minute, the local vaccine programme is making good progress and presents a route out of this for us and back to a more normal way of life, hopefully later this year, something that I know that we're all looking forward to. So now I'm really pleased to hand you over to Jill May to talk about the vaccination programme.
Thank you very much. So if we go on to the slides, first of all, I just want to remind everybody that this is the biggest vaccination programme in the history of the NHS. So it won't be a surprise that both logistically and in terms of the whole organisation, it is indeed complex. Here are just some pictures that we just want to show you. And I think what's significant about these photos is, without a doubt, it is the smiles behind those masks that signify that actually what they're about to receive is indeed the hope that we will very soon get out of this. Next slide, please. So the programme across Baines, Swindon and Wiltshire, the planning started at the end of August. It is run, and we work to NHS England in terms of the rollout, but they work to us in the BSW system. Great Western Hospital, of which many of the Wiltshire residents go to if they're in the north of the patch, they were one of the first hospitals, 50 hospitals in the country, to receive the Pfizer vaccine. Now, the one thing, I know our terminology is rather strange, but in order to offer the vaccine within our communities, we worked very closely with our GP primary care practices, and they come together with what we term as primary care networks. And those primary care networks had to indicate which site would be a designated site for them to start inviting their patients in to be vaccinated. And to reiterate again, that contact is by the GP, and it can be done by phone, text or letter. Since this time, the Royal United Hospital and the Bath District Hospital has also started up their hospital hub vaccination programme. Each of those hospitals have not only vaccinated their own acute frontline staff, but they have invited in community staff. Indeed, some of your local authority staff have been invited in to get the vaccine, but also patients who are aged over 80. One of the key areas was, we talk about cohorts of 1 to 4. In that 1 to 4, that did include any staff that work in care homes, and I'm delighted to say there was a good uptake of that. This week we saw the launch of 2 large vaccine centres, one based at the Salisbury City Hall and the other at the racecourse. We certainly are inviting, and we recognise some people who have received letters. These letters are done from a national system where letters are sent out to that cohort of people. Now, the letters actually indicate to people where they have a choice to go. Please could I reassure any Wiltshire resident, if you see anything other than Salisbury or the Bath racecourse, do not go there unless it is convenient for you and is within certainly no more than 45 miles. When we did see, when Ashton Gate opened in Bristol, the national letters set out all the vaccine sites, and sadly we did see some people travel all the way to Birmingham, but that just indicates how desperate people are. Next slide, please. So you've just gone one too many, I think. No. Okay, next one. Okay, so currently people over 80, as I said, as well as healthcare staff, are being invited, and certainly now more people are vaccinated into the next priority groups, the 70 years and over, and the clinically, and there's a word missing in this, extremely vulnerable will be contacted, and that could be people that are younger than 70. If any if you are in any of these groups and haven't been contacted, please do not worry. Certainly for those within this cohort, we have up until the 15th of December in order to offer you a vaccination. We use this a lot. The vaccination rollout is a marathon, it's not a sprint. We are here indeed planning for a 6-month programme of work, although we do know that our politicians are very keen to see we quickly get in March and April that we hit those that are aged 50 and years and over. But many of you need to and will be aware that this needs to include offering that second vaccine, and we are working to the second vaccine being offered between 10 and 12 weeks. The reason to do that is that just by going for the 12-week, it gives us no opportunity to support people if they haven't got the vaccine appointment in place. Nobody will be forgotten, and we can guarantee that every person who wishes to have the vaccine will be able to get one at one of those venues close to home as possible. Next slide, please. So as of the 28th of January, that should be today actually, we have actually done, it's just under 100,000 vaccines. So I think we need to recognise that is across the patch. Within that 1 to 4 cohort across BSW, we've got about 190,000 people. So we are halfway there. The numbers certainly also include the 10,000 plus vaccinations that have been given at the Great Western Hospital. So these weekly totals are released by NHS England, and they can be found on that website. We certainly make this information readily available to people like Kate, your Director of Public Health, and Kate is part of our operational group. The best place for further information going forward, you will see we have put in our website, which also gives detail of our frequently asked questions, as well as the latest coronavirus related news. I just wanted, one of the questions within this was, we do have on any one day a pending list of people that we could invite in should we find at the end of the day there are vaccines that are going spare. I'm equally delighted to say that BSW have the lowest wastage rate, and that is because we're doing the detailed planning, but also we do have that list of where we can call upon people. So I am really happy if there's anything else anybody wants to ask or the questions. I'm hoping that I've answered everything, but please do let me know if not and I can answer it.
Lovely, thank you, Jill. So we will go on to the Q&A now, and the first questions are for you. So first question, the government is publicising the number of vaccines that have been given to people nationally, but at a local level, there is no detailed information. Obviously, you did provide some in your presentation, but is there anywhere people can go for more information?
At this moment in time, there is nowhere where you would get more localised information. However, we are very hopeful that over the next week we will be able to provide that and give greater transparency to everybody of just how well we're doing. I would just like to say that in terms of those PCM models, as I indicated, we do know that between now and the 15th, we have got a lot of work to do to support those in the south of the patch in Salisbury. So we are looking where we're getting those additional clinics in to be able to support them. So at this moment, no, but I am really hopeful that you will be able to see that more granular information about where you live.
Lovely, thank you. Another question's come in. My relative received a letter inviting them to have their vaccine at a site which is a very long way from their home. What should they do?
Do not go in to book your appointment at that site. That's a very clear response. So your GP will be contacting you. As I said, they are still making those bookings. We are very much dependent on vaccine supply, colleagues, and everybody. I'm not going to brush that under the table. That is a significant issue for us, and we now know exactly what vaccines we are getting in next week. So for any of you, and you all live in Wiltshire, I really feel quite confident you will be hearing from your GP practice over the next couple of days to be invited in next week if you have not done so already. But please do not go outside of the BSW boundary unless it is convenient to you to do so.
Lovely, thanks, Jill. And Terence, you just wanted to add a little bit about the public transport restrictions the council have put in.
Yeah, so just to let people know that what we've done is that we have waived the restrictions on bus passes, so they've been removed so people can use those before 9 o'clock.
Lovely, thank you. So Jill, back to you, I'm afraid. So I'm in an eligible group to receive the vaccination, but I haven't received any communications yet. Have I been forgotten, and how are people being contacted?
Yes, so you will not have been forgotten. And again, I want to reiterate, and we will give you a link to what the 1 to 4 cohort is. We recognise every day we are contacted by people who are saying, I feel I am in that cohort, I am clinically vulnerable, but then when we look at it, maybe they're not. However, for those of you that are, I again say I am very confident that now we know the vaccine supply for the next 2 weeks, you will be contacted by your GP either by telephone, letter or text or email.
Lovely, thank you. And during the rollout of the vaccine, are there plans in place to call potential recipients at short notice to cover no-shows?
Absolutely. So with every site that is running on any one day, there is we fully understand what the numbers of vaccines are. At two set times within the day, we catch up with each of them to understand anybody that has not attended or where they believe there is going to be additional vaccination. We have a process in place, and we have indeed worked with your local authority. We have names of those organisations that will then quickly mobilise people who are ready and waiting to go to any of those sites to get that vaccine. So I just want to reiterate, we're really delighted that we have had absolute low numbers of wastage.
Brilliant, thank you. And what is the current waiting time between receiving the first and second vaccines? And is the government's recommended timescale the same as those recommended by the manufacturers?
Yes, so we are working to the, well, it's a 12-week in between both vaccines. We have said we will start to invite from 10 weeks in order to accommodate if people do not attend or they haven't got the message or there are issues, so that we do not go over that 12-week deadline.
That's great. Thank you very much, Jill. So just moving on, Andy, we've had a couple of questions about the budget. So with many shops closing on the high street, will the budget be impacted by reduced business rates coming into the council?
Yes, so it is an area of concern. During this financial year, we've issued around 70 million of business rates reliefs and around coming up to 120 million in business support grants in just this year alone. So most of that support will stop, and as yet nothing's been announced by government in terms of any support continuing from 1st of April 2021. So we have assumed a reduced level of business rate receipts in the budget for next financial year by around £1 million. We'll continue to review that during the year to see if that was an accurate assumption and estimate, and if it's not required and we are actually gaining the level of receipts that we would expect, then we could potentially use that £1 million to support local businesses in next financial year as part of Wiltshire's recovery.
Thank you. And also, how will the £4 million over 4 years for Market Town's recovery be spent and allocated?
Okay, so the details around how that fund is going to be invested will be determined in next financial year, so that those details aren't determined yet. We're probably going to be looking at ways in which we can maximise that funding with other local investments, other local ideas, and how it can also then be utilised through the government's Levelling Up Fund that they've announced to support communities.
Lovely, thank you. And Philip, I believe you wanted to add to that.
Yes, just to say that we've got 20 plus market towns in the city. What we won't be doing is just simply dividing that £1 million this year by 20 and give them all a small amount each, because that is of no benefit. So what we're looking for are initiatives that we can use and reuse. So we make an investment into an initiative. It might be a directory, it might be some other means, and then that can be replicated in many of our market towns, those that want it and can make use of it. So we get more than £1 million worth of value out of the £1 million worth of investment.
Thank you. Terence, I've had a question about the election. If someone doesn't have access to the internet, how do they register for a postal vote?
Okay, if someone doesn't have access to the internet, they can phone our customer services on 0300 456 0112, and we'll send a form for them to complete. And hopefully we'll get lots of people asking for a postal vote.
Lovely, thank you. So, Kate, a few public health questions now. Does the virus linger on objects which come into the home? Do I need to disinfect groceries, especially those in plastic bags? And should I quarantine post, newspapers and parcels?
Thanks, Kerry. So the infection risk from a COVID-19 contaminated environment decreases over time. It's not yet clear at what point there is no risk from the virus. However, studies do suggest that in non-healthcare settings, the risk of residual infectious virus is likely to be significantly reduced after 48 hours. So whilst potentially present on surfaces, if you have been shopping, there should be no need to sanitize the outer packaging of food. And that's because food businesses are required to have systems in place, which should include keeping that packaging clean. The most important things to remember are to follow good hand hygiene practice, washing your hands regularly as soon as you come in if you've been out anywhere, 20 seconds, soap and warm water, going back to singing happy birthday twice again. And we need to make sure we're doing that, including after we've handled any groceries or items such as post, parcels, and regularly cleaning frequently touched surfaces, Kerry.
Lovely, thank you. And Kate, we've had regular updates on the number of deaths and hospitalisations from the virus, but do we have any idea how many people are suffering from long COVID? People seem to think that's something affecting much younger age groups, and although not fatal, seems to be causing major issues.
Okay, sure. Thanks, Kerry. So the most up-to-date figures released by the Office for National Statistics estimate that there were approximately 301,000 individuals with COVID-19 with symptoms lasting between 5 to 12 weeks. That data was from the week commencing the 27th of December, and that was for England. So long COVID or post-COVID syndrome can affect anyone of any age, and the chances of having long-term symptoms do not seem to be linked to how ill you were when you were first diagnosed with COVID-19. So in response to the growing evidence around long COVID, the NHS have set up a number of clinics nationally. And, you know, if you or anyone you know thinks you may have symptoms consistent with long COVID, then you should contact your GP and have a chat with them.
Thanks, Kate. And the last one, my elderly father lives alone in Wiltshire, and I deliver shopping and try to spend an hour with him daily for company and exercise. His companion lives alone elsewhere. Are they able to meet and spend time in each other's houses if I still visit him?
Okay, so the current national lockdown guidance states that you should minimise time spent outside of your home, but obviously you can leave your home for various reasons, and that includes shopping for basic necessities for you or a vulnerable person, to exercise or to meet people in your support bubble. So in this scenario, if you are only meeting your father outdoors and for exercise and you haven't formed a support bubble, then your father would be able to form a support bubble with his companion. However, if you have formed a support bubble with your father, which includes entering each other's homes, then at the moment no other support bubble can be formed.
Thanks, Kate. Philip, we've had a question about business grants. So what's the approval process for the newly announced grants for businesses, and how long will it take for a business to normally get the funding they've applied for? Sorry, Philip, you're actually on mute.
You'd do it once. I knew that I'd manage it one time. The new grants announced by the Chancellor on the 5th of January have got the same eligibility criteria as the local restrictions support grant. And these are for businesses that have been closed due to the national restrictions who are on the business rate system. That means that if you applied in November, there's no need to apply again for this funding and payments. We will make those automatically to you. Clearly, if there's no contact on wherever, you can always get in touch with us. If you've not yet applied, please read the information on our website before submitting your application to make sure you submit the correct information. But as I say, if you've already done the original application and that was successful for yourself in November, we should be making further funding and further payments to you. This normally takes, after applications, it normally takes between new applications, normally takes between 5 and 10 working days, and then that can include some time required for the actual payments to transmit to your plan, because we still use the BACS system rather than what we use in our own homes, which is instant virtually. Businesses not on the rate system, or those who have not had their premises closed by the restrictions, should apply for the additional restrictions grant, and that went live on our website yesterday, and the window is open until the 12th of February. So make sure you go on the site and apply. If in doubt, contact us and apply.
That's great, thanks, Philip. So the last question this evening is for Terence. It's about schools. So it was announced today schools won't fully reopen until the 8th of March. So is the council going to provide any additional support to them during this even more protracted time?
Thanks, Kerry. Yes, we've been supporting all schools in Wiltshire, be that maintained or academy schools, throughout all of this pandemic, and we're going to continue to do that. That will include support with remote learning, the rollout of testing, and the access to digital devices. You may well have read that the council is using some of the funding we received from central government for additional devices. So I'm glad that we've been able to do that. And yes, we will continue to support all of our schools who've been absolutely magnificent throughout this period.
That's great, thanks, Terence. So that's all the questions we've got time for this evening. So Philip, I'm just going to hand over to you to say a few words.
Which means I've got to unmute yet again and manage to do it before starting to speak. That's it from us tonight. Thank you for sharing your free time with us. We really do appreciate it. We appreciate everyone who comes in and logs in, looks in and listens to us. It's a very tricky time at the moment. On one hand, you've got a lot of infection around in society. On the other hand, we've got the hope of the vaccinations being rolled out and making a significant difference. Please make sure you don't let the hopeful bit stop your behaviour in the tricky bit. Please make sure you're still behaving as though this COVID just around the corner, just waiting for you, because the most illogical thing would be to end up catching COVID the week before, a few days before you get your invite to have your inoculation. Hopefully, what's come across tonight is that everybody's working hard to keep as many people in Wiltshire as safe as possible. If you've got any comments about tonight's session, please email communications@wiltshire.gov.uk. We look forward to speaking to you again, but in the meantime, please stay safe, please stay at home if you can, please socially distance, please wear a mask, and you know all the rest of them by now. So good night for now, and we'll see you again soon. Thank you.